NTV, and we get to look at TechNot this morning, focusing on the plight of intern doctors. Now, I'm looking here to a press release, deployment of medical interns. This was released on the 27th of July, 2023, and it starts: the Ministry of Health has received clearance to deploy medical interns to the 58 internship centers across the country. Subsequently, Ministry of Health has released a deployment list for the interns under revised terms as guided by government. The delayed deployment was occasioned by factors beyond the control of the Ministry of Health. Government will therefore deploy the 1,901 medical interns within the available budget and a net monthly allowance of 1 million Ugandan shillings to cater for accommodation and feeding. All the medical interns are expected to report to their various training centers by the 3rd of August 2023. The respective hospital directors will be issued a notice, and the interns with deployment letters and organized for their induction. I wish all medical interns a successful apprenticeship program. And this is Director of General Health Services, Dr. Henry Mwevesa. This brings us into our conversation here on Morning at NTV. We've looked at the plight of medical interns and the many strikes and the efforts that they've had to pour in to get their voice heard and their situation heard. And so, to have a better understanding of what this actually means, we do have Dr. Herbert Luswata, who is the Secretary General of the Uganda Medical Association, joining us to help us understand, is this a moment to appreciate the Ministry of Health, or what is the translation of this for the future of the medical fraternity by and large? Good morning to you, Doctor.
Yes, good morning.
So we sit here once again, and I believe this is on the helm of good news, that finally the Ministry of Health has heed to the plight of the intern doctors, and they've finally gotten what they've been asking for, placement of internship. That has come through, but of course it has come through with different terms and conditions. Let's start from there, the different terms and conditions that actually had to be considered if this was going to be a reality for intern doctors.
The different terms and conditions, initially in 2019, the interns used to earn 900. It was a gross, and then a take home of 750. Then we went to Parliament and made a presentation over this issue because of the inflation at that time. And then Parliament made a recommendation of a pay of 3 million per intern. Then during that time it was not implemented. Then in 2021 we went to State House, we met the President and had a further discussion on the same issue, and considering the inflation we agreed with him and we say that this money needs to be increased. So he suggested that we can bring it down to 2.5 instead of 3 million, so that the intern doctors can get half of what their seniors are getting as a start. And we agreed and actually wrote off that directive. So subsequently in 2021, actually the interns started earning that money. So on the press release from the Director General of Health Services, number one, as UMA, we appreciate the fact that finally the medical interns are being deployed to go and start doing their internship, because this is going to help us solve a number of issues that have been happening right now, and one of them is the overwhelmed workload on our colleagues who are working in the different government hospitals, because they have been crying out on and on about the work being too much, working 24 hours, not able to finish the lines of patients. They had a lot of burnout, and it was becoming very hard for them to handle the patients. Then number two, the cry from the public. The patients' waiting time was becoming too much. Some patients could come and wait the whole day and they don't receive any medical services. And the number of mothers and children, even accident victims who were dying, was increasing every now and then, and it was becoming a very big and challenging problem. Actually, some hospitals, like Kawempe National Referral Hospital, Soroti Regional Referral Hospitals, and other hospitals had local arrangements to request that time they were pre-medical interns to just come in and offer a hand. And the reason why they were doing that is, much as we are advocating to get them formally deployed with a better pay, But seeing patients dying was overwhelming us, and we said, I think, as we advocate, let a few can go in, go and give a hand. And actually, a number of pre-medical interns had to go and start volunteering in Kawempe National Referral Hospitals, to avoid the deaths from these children and the mothers. We had a good number of them in Soroti Regional Referral Hospitals, and we knew about local arrangements in other regional referral hospitals, and that's why actually, much as they were not deployed, yes, there were some alarms, but somehow they were being controlled because of those ones who were volunteering for the safety of our patients. So, by and large, we are happy that finally they are deployed and they are going to be covering the huge human resource gap we have in our health facilities, and their services will be able to continue. Initially, when I think Minister of Health had put out a call and we are saying that people who can afford to facilitate their internship should just go and do free internship. That was a very bad thing, and it was going to be a very bad precedence, because they were going to take back to modern day slavery, which is not very good. Deploying someone who has a degree already in medicine and surgery, in pharmacy and nursing, to work for a full year for free, it was going to be such a very bad thing. Their needs are very many. And our worry mainly was actually to the people who are going to give the service, that is the public. You know, I always say, when such things come up, that even our government, which is in power, when they were in the bush as NRA, when times became tough during their struggle, they could raid, you know, take cows and take food, because they needed to survive. And if they did survive, they wouldn't be there today. Fortunately, when the president took power, like for me, I come from Ruero, I understand he tried to do something to ensure that he compensated those families. He remembered that they took their things, which is a good thing. So what was going to happen to these interns deployed with their degrees without any allowances? It's like, you know, giving a soldier a gun and you don't give them a salary. They will misuse their guns and get their salary out of it. So these people are going to use their degrees to instead harm patients. They are going to extort money from patients. They would, you know, when we have ethics and professionalism when you're practicing, when we are providing care in the hospital, we give care first to those ones who have the most urgent need of these healthcare services. Those ones who are very sick, we think they can die if they don't get care immediately. That's how we call it triaging. Those ones always receive care first, and the reason why we do that is prevent death. So if you can stay for 6 hours, I could start with someone who can die in 30 minutes. But when the issue of work dependent on who can provide money, it becomes a totally different story. You find a doctor or an intern nurse working on a patient who is not very ill, who is not even dying, because they have given them money, and they will leave someone who is dying, and they will actually die. So it becomes a danger. Instead of these people saving people's lives, they will just go there and do. But when their work is dictated by who can give me money, who can give me more money.
Which has been the plight really of public service when it comes to medical. But looking at that money in particular, Ministry of Health says that according to their budgets, that's what they can afford, the 1 million Ugandan shillings. And yet you have just informed us of the agreement that you had of the 2.5 that had been raised from the earlier 900,000 Ugandan shillings. So in light of that, what was the term and condition of agreement that these interns should accept this 1 million Ugandan shillings? Isn't this going to be a case whereby the Ministry of Health can carry this on for yet another lot of intern doctors for maybe another 2-3 financial years without going back to the original directive that came through the office of the president?
You know, the 2.5 million was a directive from the president, and when he signed that directive, it became a policy. So currently, what we have at hand, the president has not rescinded that directive. So that policy still stands. And when you look at the letter from Director General of Services, it's saying that they are paying this money because that's what they can afford within their budget. So the problem is the budget they have at the moment, but the policy has not changed. And that means that as soon as, I don't know whether the problem was because they didn't budget better, I don't know. I don't know where the problem is because of the economic.
But we can't say they didn't budget better because these strikes have been on for a long time, you know. So it's not even just in interns, but the other specialized doctors.
Yes.
These strikes have been ongoing for a while.
Yes, anyway, from the information we got from Parliament when we are actually about to pass the budget, which we are in this time around, the budget, according to Parliament, they discussed and they agreed that the required amount of money for the medical interns and the senior house officers, which is 80 billion, was supposed to go in the budget. Mm-hmm. So they knew about this, and however, after that, and when there was a resolution from cabinet that actually this money should be paid, and they directed the Minister of Finance to ensure that this money is found, there has been a lot of drama and you know, back and flow movements. The minister says this today, the other day says another thing. Sometimes he tells you that, okay, I have the money, but I'm waiting for the president to tell me to dispatch the money. And here you have a full cabinet resolution where the president is the chair, already saying that give them the money. So there was a lot of confusion. At some point we thought that maybe the cabinet just made the resolution just in passing and they didn't mean what they really said, or maybe the president changed his mind. We kept on wondering why the Minister of Finance kept saying that his again is waiting for another instruction from the president. It never really made sense to us. Anyway, what we shall take is what the Director General wrote out, which is on record, that these are budgetary issues. And as long as the president has not rescinded this directive of 2.5 million, as long as their budget issues are settled, we should go back to the 2.5 million. And as Uganda Medical Association, we are going to follow it up to ensure that we go back to that amount of money. Because even in public service, or when you're having employees under employer-employee relations, you are not supposed to reduce their money. You can only increase, you cannot reduce. And I'm sure even the president and even the government officials know that. So at some point, we shall continue engaging in discussions, find out where was the problems, what went wrong, and ensure that we go back to that money, which is the 2.5 million. Because according to the current economic situation we have in Uganda, that is the money they need, which is befitting them. The 1 million, yes, will do something, but it will not do what the 2.5 million has been doing. And we need them to have enough money so that their quality of life is better, and also provide a better services to our patients. Okay,
all right. Still speaking money, the other categories of doctors, they have also been, you know, seeking for increments. Has the ministry given you any hope that that increment is going to be considered?
Yeah, we have, there was the senior house officers, they were demanding areas. Those ones were paid because in the budget they passed 22.1 billion. And that money paid their areas in the past financial year. They have all received their money, because they are those ones who are demanding 6 months, 4 months, 5 months. They received their money. And in this financial year where we are, we know, because no one has said that they will not pay them, but we know they are supposed to pay them. Then we have another category, which is the supervisors of interns and the senior house officers. These are the specialists, the surgeons, gynecologists, and pediatricians. Their issue was on salary discrepancy. When they were raising salaries of health workers in 2021, there was an error which was made actually by public service. When they were allocating their salary, they did not put into account their academic qualifications and the job description. So we had a meeting at the President's office with the Secretary to Cabinet. We had the Chair of Service Commission, the Public Service, and Ministry of Health to discuss this matter. Because when you look at the start salary of a medical officer, you have a degree in medicine and surgery. But then when you become a specialist, you have to go back to school for a minimum of 3 years to get a master's degree in either medicine, surgery, pediatrics. So that is an additional qualification which requires 3 years. And then the work you do also changes. You provide specialized care, you supervise intern, you supervise medical officers, and the context of specialized care is huge. So now when you look at the salary of a start salary of a medical officer is 5.4 million, and then the specialist is getting 6 million, so the difference of only 600, which does not make sense. It does not really match the qualification and the job description. So we discussed this matter at the President's office, and we all understood that surely there is a problem.
Okay.
And one of the reasons, or the response was from public service was like they were not aware that these people have additional qualification. The problem came from their nomenclature, medical officer special grade.
Okay.
And so from that meeting we resolved that Minister of Public Service should go back and do a new job evaluation and the qualification, and then allocate a new salary which is befitting for the specialists or supervisors.
Which would then allow you to actually advocate for the increments that you're asking
Exactly. But
let's first take a break on that conversation right there, and then we'll pick it up from there. Resolutions moving forward. Do stay with us.
Morning at NTV.
Into the 8 o'clock hour, it's Morning at NTV, the final band of July 2023. I am Priscilla Regina Neloga. Thank you so much for joining us this morning as we look at the never-ending plight of doctors. And will there be a light at the end of the tunnel? Before we went into the break, I was with Dr. Luswata from the Uganda Medical Association, and he was giving us an update on the monies as far as the other specialized doctors in the field of medicine are concerned, and he had alluded to the fact that there had been a discrepancy between public service and the Ministry of Health as far as the nitty-gritties of accreditation are concerned, and that is the reason as to why they've been having the salary discrepancies. But we were talking about resolutions, and so Dr. Luswata, in regards to resolutions, what is the commitment of the Ministry of Health towards public service in resolving this, so that it is resolved in this financial year to have a better remedy in the next financial year?
Yeah, and in the meeting we had the President's office with the Secretary of Cabinet and the head of public service. Minister of Health was directed to write formally to Minister of Public Service to highlight this error and the need to correct the salary for the medical officer special grade and the title. So as of now, Minister of Health has done their job, and this is the guidance they were supposed to do earlier. So they have already written formally to Minister of Public Service to ensure that these two, the salary and the title and a clear description of who a medical officer special grade is done. So now we are following up with Minister of Public Service as we are counting the 60 days. So this time around on this issue, we are together with the Minister of Health. At least there is no pull of ropes, because we agreed and we all realized it was a mistake. And hopefully this matter will be settled, because after the 60 days, which we are given to public service to do a job evaluation, we are supposed to go and meet the President so that they can explain to him that much has directed that there should be a salary increment. There was an error which was made and need to be corrected. And after getting the approval from the President, the new salaries for the specialists will be put in the budget for 2024-2025. I think the budget process is going to start around September. So at the beginning of the budget process, these monies are supposed to be put there, such that this time around they don't lose out. The other alternative was, if it is possible, maybe the government can just pass a supplementary budget, and then the salaries are corrected within actually this financial year, because the money which is required to correct this salary discrepancy is little. It is only 21 billion. So we are following up on that to ensure that the supervisors or medical officer special grade are also sorted.
Okay, all right. That arrangement with the Ministry of Public Service is actually on day 25, as I'm meant to understand. So that leaves you with about a month and 10 days.
Okay, sorry. The meeting was around, it was on 8th June. So that is, I think we have now made a month and a few days, like 6 days. So meaning we are remaining with like maybe 24 days.
Okay. So we're hoping that by end of August that will be streamlined to be in time for the budgetary process starting in September.
Exactly.
Okay. All right. Well, all the best in that regard. But now we come back to the medical interns. When it comes to medical intern situation, it has taken them numerous strikes. Some of them have had to go behind bars in this regard. And Parliament's intervention to actually have the Ministry of Health with the Ministry of Finance adhere to and lead to what we're talking about this morning, their deployment as of 3rd of August 2023. Is this the course that we're going to be seeing from the Medical Association?
Not really, but you know, these issues of strike, threatening to strike, it is not really what we wish to do always as a medical fraternity. These things come up because sometimes you're really pushed on the wall. And for this time round in particular, it was because of some such suggestions like, you know, non-payment of internship, and we couldn't really stand that. However, in the different discussions with different government entities, a number of things have been proposed, and we are following up on these things. And one of them is the internship policy, because when you have this internship policy, it describes everything that you need about internship, including the pay. And when this pay is written properly in the policy, then it will never change. And then the policy will describe clearly the internship sites. It will give you a clear description of how interns are supposed to be supervised and who is the supervisor. It will give you the clear terms on how the interns are supposed to be accommodated, because they also need accommodation. And all this, when you have it in a document where you keep reference, it becomes a good thing. The other thing, which I'm sure you have been following Minister of Health a number of times, talking about the numbers are increasing, the numbers are very many. In this policy, we can also put something which can help in better planning of this internship. And actually, a number of times, even in State House with the President, we discussed the issue of numbers of health workers who are being produced every year. And at that time in 2021, the President said, no, we have very few health workers. Actually, we need to train more.
And while you make a comment on that, also respond to some rumors out there that other doctors, nurses are also going to decide to take to the strikes, seeing as it has yielded some solutions for the intern doctors. In your closing remarks.
The professionals?
Yeah.
No, you know, when among the interns, we have intern doctors, nurses, and pharmacists. So the ones who were saying that they are going to strike, actually we are going to join our strike. That is the graduate nurses, the pharmacists, and then the dentists. Because among the interns, they also have members who are also being suppressed over the same issue. So it was going to be a strike of Uganda Medical Association, and then those are the partners we are going to be with in this struggle by joining us.
All right. So as the Medical Association, what's the way forward?
We need to work on this internship policy, and then the senior house officer policy. And these policies are supposed to describe clearly terms and conditions of internship and the SHOs and how a business is supposed to be conducted. Number two, because initially the President said we need more health workers, we have seen that more medical schools have been opening around. Even different private universities have been actually allowed to, you know, start training health workers. And the President has been encouraging more and more students to do sciences and do these courses, so that they can help the country. So we are happy that the President was achieving his goal of getting more health workers. But if now we have a setback and government thinks maybe now there are too many, then we need to go back to the drawing board and see how we can regulate the number, so that we can have those ones we can manage with better pay, with good quality, and they can give a service we need or we expect from them to the public. And one of the things we proposed was, at admission, we can have a national exam for all the medical schools when they are admitting these students into medical school. They do a common national exam. So use this exam to pick the best performers, and then you limit the numbers. So you direct each and every university that this is the number you should admit this year. So when you have that kind of data as a government, it helps you to plan. By the time someone finishes the 5 years for a doctor, the 4 years for the nurse and the pharmacist, you have already planned them in the system.
Okay.
And when they
That's
finish...
a smart system that can be deployed. Unfortunately, Dr. Swata, we are out of time, but we're wishing you all the best as the Medical Association, and look forward to helping, you know, aid your voice to what is necessary for the protection and the quality of medical interns that are out there. Now, away from that, we want to join Ivan